This administration's immigration policies are extraordinarily harmful and traumatizing, and the bill would increase that harm immensely, giving ICE a $45 billion slush fund for detention. Just to put that into context, ICE's annual budget for immigration detention is less than $3.5 billion. So this is a massive increase, and the increase alone is bad, but I just want to point out something very important, which is that the policy changes that the majority is trying to slip into their so-called funding bill are even worse. So my amendment would strike the provision that allows for families to be detained indefinitely. This provision would overturn the Flores Settlement Agreement, which has helped protect children in government custody for nearly 30 years. The Flores Settlement Agreement's principal purpose is to ensure that children are released from immigration detention as quickly as possible, recognizing the harm to children. Children in the custody of the DHS have to be placed in the, quote, least restrictive setting, and they are not allowed to be detained for more than 20 days. But this bill actually makes a very important policy change, and it gets rid of that requirement. It allows families to be detained throughout their immigration proceedings through their removal if they're ordered removal. But with the immigration court backlog, that means that families could be stuck in detention for years. Now, family detention has historically been used only for arriving families. But now, Trump is incarcerating families who have already been living in our communities as friends and neighbors for years. One of the youngest children being detained is only 1 year old. 1 year old child being put into detention. That is unacceptable, especially considering that much of the families detained under this provision and much of the new money provided for immigration detention is going to go straight to private for-profit prison companies. For-profit, privately owned prison companies are incentivized to make as much money as possible, often at the expense of the health and protection of individuals forced into their care. Private immigration detention facilities lack necessary oversight, they're often unsafe, and time again, that has led to a lack of sufficient health care and resources for detained individuals. Some of the most egregious abuses that we hear about of immigrants happen in detention facilities that are run by these for-profit private companies. Unnecessary medical interventions, forced labor, abuse of solitary confinement, and intimidation have run rampant. You might remember a case in Georgia, Mr. Johnson was with me when we went to visit, where immigrant women were being forced into sterilization procedures. Experts hired by the DHS office, that detention center, by the way, we were able to shut down thanks to our advocacy. Experts hired by the DHS Office for Civil Rights and Civil Liberties, an office that the Trump administration closed without any congressional input or consent, conducted secret inspections of these detention facilities. Their investigation contains over 1,600 pages detailing conditions in these facilities, which they describe as, quote, barbaric and negligent. Private prison companies owe their first duty to their shareholders, not to the people they detain. They prioritize profits over people and care, and that is clear from a recent report in which medical experts determined that 95% of in-custody deaths that ICE reported between 2017 and 2021 were actually preventable. And of the 15 immigration detention centers with the highest number of deaths during this period, 13 are run by private prison companies, including a facility near my district, the GEO-run Northwest ICE Processing Center. I'm sure it's a total coincidence, but in 2024, GEO Group's PAC gave nearly $4 million to Republican campaign groups. And they're poised to make hundreds of millions of dollars in taxpayer money from the bill's detention expansion. The Flores Settlement Agreement has guided our government's policies for detaining children for over a quarter of a century. And I want to be clear about what it looks like for kids before. When the Flores case was filed in 1985, children were held in indefinite detention in poor conditions without access to basic medical treatment. They were handcuffed, they were strip searched, subjected to body cavity searches, and required to sleep in areas and share bathrooms with adults that they didn't know. I can't imagine that that's something that anyone on this committee would want, and I would ask for the support of our Republican colleagues to prevent the overturning of Flores. I yield back.